Hey everybody. So I was thinking that I was going to start this new thing. I'm going to vlog about my blogs and we'll see how it goes. You can read my blogs on my website, LoriFromGetMidwife.com, and there's a pretty good collection there of blogs that you can read. But I wanted to start today by talking about autonomy and birth and who actually gets to make the decisions about uh, your care. Um, Birth is a spontaneous, autonomic body system, meaning that it begins spontaneously inside your body, continues spontaneously, and ends spontaneously inside your body. It's like your heart beating, it's like your breathing, it's like your digestion. Like you don't go to the hospital to have your period, you don't go to the hospital to poop. You don't need to go to the hospital to have your baby. You honestly don't. Now, if you have problems with your period, or problems with your digestion, or problems with your reproductive system, yes, a hospital is a totally good, legit place to get that stuff worked out, get it figured out. But just for any normal, regular birth, um, the hospital is not needed. If you're a healthy mom, healthy pregnancy, you're so good to stay home and have your baby. Um, but it does beg the question in the medical model system of who gets to make the decisions about your care. Is it the doctor? Is it the nurses? Is it the protocols? Is it the judge? Is it the cops? Like, who gets to make these decisions? And actually, studies show the best decision maker for the baby and the medical process is the mom. No surprise there. Midwives know that. We don't need to look to any outside factor or influence to find out who the best person is to make decisions for their care. So it's important to think about, you know, what influence the care provider has on your decision making. And is this care provider's influence coming from a place of fear, their own bias to a preferred outcome, um, maybe some more subtle issues like who's in control, who's in charge, how it's going to be, what the expectations are? I think that when you hire a midwife, you're definitely going to have a natural birth bias, but natural birth is normal. So to have a bias towards something that's normal, I don't know if that's actually a bias, but it's something to really consider. When it comes down to making some important decisions about who, what your blood pressure is, or what position to give birth in, or maybe your blood sugars are a little bit high. Sure, the care provider is going to have some knowledge and some experience, but the mom's experience is as equally important. And this is super important. Most of my families are highly educated, they've done their research, everybody knows what they think about vitamin K, IVs, epidurals, C-sections, VBACs, being induced, all of that stuff. My clients are some of the smartest consumers of the healthcare industry around. And that's true for all midwives, so that's pretty awesome. But often when you choose something different in a hospital setting, it leaves the care providers feeling really uncomfortable. In my mind, that's too bad. But in mom's minds and experiences, that's kind of hard to live with the too bad. So it's important for you to take charge of your birth and at the same time find a care provider who you can kind of fall back into and trust that your wishes and the relationship that you build is going to be at the center of all decisions that are made. So, midwives are super skilled in this area. It's one of the best reasons to hire a midwife. And I hope that you all have great births. All right, take care. Bye.